I'm James. I'm one of the lecturers here at AIU. I specialise in adult nursing and skills and simulation, although my background was primarily renal nursing, where I worked in the Cambridgeshire area for about 15 years. So I worked with the community dialysis team as part of that renal nursing, where we would look after patients in their own home doing home dialysis. This is two types of different dialysis that they can do in their own home, either peritoneal dialysis or home hemodialysis. So I was involved in setting up the patient's home with their equipment, teaching the patients how to do their dialysis, and then looking after them at home. So I'd go out and make sure that their dialysis equipment was working, that they knew what they were doing, that they were safe to do it at home, and also I'd go out and see them in clinics and do blood tests and other dialysis fluid collections and things, so we could monitor their blood results and make sure they were getting the best care. So what I enjoyed most about that bit was seeing people in their own homes. It's so much nicer to meet someone in their own home. They're much more relaxed than they are in the clinical setting. Sometimes with the home hemodialysis, patients would live miles and miles and miles away from their closest unit. We had patients who would live in the north of East Anglia, sometimes on the coast, who'd often have a 2-hour drive to get to a hospital, so it was much better for them to go and do it in their own homes. So it was really good to see them in their own homes thriving. So community nursing is a great career choice. You get to see a diverse section of the population, you get to nurse people in their own homes, you get to meet a variety of different characters. And in my background, I didn't just do renal nursing in the community, I'd also done some research in the community and some other types of home care. So it was really good to see a variety of different populations. I once had to drive all the way down to Southampton to collect a rare blood sample, for example, and I've got some really funny stories about people and their pets.